Good morning, good afternoon, and good evening to my wonderful friends all over the world. Depending on wherever you are watching me from, it is still your favorite dental and mental health expert. I am here today to bring some good news to you. But before I go on, I still want to remind you please, if you have not subscribed to this YouTube channel, kindly hit the subscription button and do well to share and like this video. Share it to all your friends across board, your colleagues, your family, your enemies. Just make sure that they have this video through whichever channel that might be convenient for you to do that. But just let this good news get to them as quickly as possible. Today, I will be bringing to your doorsteps some basic uh, dental treatments, things that kind of dental issues you have, and the kind of treatment that could be uh, given to that kind of dental issue you have. Number one on my list is the one we call oral health instruction, OHI, oral health instruction. In my previous video, I talked about that there are sometimes you get to the dental clinic, you may not have any treatment done to you. You may end up just getting maybe advice or encouragement to continue doing what you are doing, especially if what you are doing is good enough already. So most times you go to dental clinic, it's not necessarily that you must go through a treatment procedure. So that's why we have what we call oral health instructions. And it come in different ways. It can be one-on-one, it could be addressed to a crowd and all that. This simply talks about telling or advising you or people what and what to do, what and what not to do to keep your oral health in good condition. It is during this kind of session that you can also ask maybe some questions, you'll be clarified, you'll be told how to brush, when to brush, the kind of toothpaste to use, the kind of toothbrush to use, and all that. So it is very, very important. In fact, many a times, if this particular procedure is properly followed by people very well, you will find that it will be very difficult for people to come down with very serious dental issues, because by the time you know what to do, when to do them, and avoid what you are supposed to avoid, you will hardly come down with dental problems. So today I will advise you to seek for this information. Is very important. One of the ways is, or you can also check through my YouTube. You'll see that I've done some videos on some of these issues that can help you know what to do, what to avoid, and what to do when some of these issues come up also. Number two is what we call scaling and polishing. Scaling and polishing is one of the painless dental procedures, what we can call professional cleaning. Like the way you brush your teeth, we will be advised to brush your teeth twice every day, last thing before you go to bed and after breakfast in the morning. Many times our toothbrush don't seem to get to some parts of our mouth, as the case may be. So when you get this professional dental cleaning, a lot of things professionally, things that are in some places your toothbrush cannot get to, will be removed. Some stains that are so hardened to the tooth enamel that your brush cannot remove them, these things will be removed in the course of this procedure. Some other food particles that have gotten deeper into your gum, who have gone just below the gum line, those things can be comfortably removed. So, and they can be done in the process of what we call scaling and polishing. This is what we advise people to get at least once in 6 months. Once in 6 months, make sure you get your scaling and polishing done. It does not necessarily mean that you will have a dental problem before you have this procedure done. It's advised everybody, as long as you eat, you talk, you drink, whether there is a problem or not, make sure you get scaling and polishing done once in 6 months. That is the advice, and it is very important. In the process of this scaling and polishing, when it is done, a lot of things could have been taken care of. A lot of gum issues that would have come up would have been taken care of. For those who even have mouth odor, smelly mouth, by the time this is done, is enough to even take care of some of these things, especially if they are not systemic. So a lot of issues that relates to dental issues would have been handled. Even some cavities that may even come up in the course of this scaling and polishing, a lot of things would have been treated, a lot of things would be taken care of, a lot of things would have even been observed that they can quickly be addressed before they get worse, as the case may be. Number three, or the next one, is filling. You see, sometimes when the tooth has a cavity, maybe you are not feeling anything yet, maybe you don't feel sensitivity, you don't feel pain, you may not even know you have a cavity. Most times it will be found out in the course of maybe the dental examination or even the scaling and polishing. You will not notice that there is a cavity, but you are not feeling any sensitivity, you are not feeling any pain. At that stage, a simple filling would have been taking care of any other problem that will come up in the future. So that's why we advise that at that moment, once they do a simple filling, permanent simple filling, and you won't have that cavity will not degenerate, it will not go deeper and all that, you live your normal life as you wish. So we advise, but once the cavity has gone deeper than what is supposed to be, probably you've started feeling shock or you started feeling pains, it would then be another deeper filling. Probably maybe it would have required an RCT, what we call root canal therapy. That's like a more invasive filling, that after that particular procedure, the particular tooth may need to be capped, what we call dental crown, so that to reinforce the tooth so you can still use it to do normal things you use other teeth to do. So but most times before it gets to that particular stage, if it is still at that stage of where a simple filling can solve the problem, you will do that without any much problems or challenges. Then the next one is extractions. You see, most times, just like what we normally say, dental issues don't happen overnight, except if it's an accident or a trauma. But anything that has to do, it normally takes time. So it's either that there is a point of neglect, or there must have been somehow that you didn't care, or you didn't think that it was necessary at that time to get a professional dental attention. That's where the issue comes. Before it gets to the point of extracting a tooth, there is a point of neglect that must have occurred somewhere, because the dental cavities don't occur overnight. It takes time. So but let's assume that all these things have already happened and it gets to a point, maybe the tooth is badly decayed or is grossly mobile and all that the last resort will be to extract the tooth. So extraction is another treatment procedure. When the tooth is extracted, the patient goes home, and there are what we call post-ops, like post-operation instructions that will be given to the patient what to do. In most cases, you'll be told to do salt in warm water gargle 24 hours after. You'll be told not to eat some things. You'll be told not to do some things, to get enough rest, as the case may be. So, and most times before the extractions happen, the patient would have also know that this tooth is to be removed. The consent of the patient is gotten and all that. And mostly, once it is removed, maybe after some time, the next 24 hours and all that, healing will start taking place, especially when you are religious enough with all the instructions you were given. Another one is what we call curettage. You see, there's a time that the gums will be so diseased. We have a case what we call periodontitis, that the gums disease has gone deeper. Probably there is even a mobility of the tooth or of the teeth, if there are more than one in the mouth that is already affected. In that case, a treatment procedure called curettage can also be done to treat the gums, remove some of the debris, the dead part and all that, and the patient will be placed on some medications and some other exercises to do that will also include salt in warm water gargle and all that. But one of the things is that if you go through this list I've just mentioned now, if you are so intentional and conscious about the number one, you will hardly have the reasons to go through number 3, 4, 5, and 6. especially if you are conscious and intentional about number one and number two. That is oral health instructions and scaling and polishing. If you are conscious and intentional about this number one and two, you will hardly have reasons to engage yourself in the other numbers I just mentioned. But before we go on, like I said, please, if you have not subscribed to this YouTube channel, kindly hit the subscription button, kindly like and share this video to your friends. Don't keep it to yourself. Once you have this kind of knowledge, don't keep it to yourself. Share it to your friends, your family, your colleagues at work, your colleagues in school, everywhere, even your enemies. Please don't make enemies with this video. In fact, make sure that that person who is your enemy, that you make friends with that person with this video. Send it to that person, and the person will thank you so much for sharing this kind of information with him or her. So please make sure you are intentional about getting this information about your oral health. Is very important, and make it a habit, a conscious habit, that every 6 months you must visit the dental clinic for some checks and possibly to get your scaling and polishing done. And I promise you, if you are conscious and intentional about this, especially that number one and number two, you will hardly have any reason to engage yourself with the other numbers I just mentioned. So until I come your way next time, make sure you keep well and share this information to everybody around you. Thank you so much, and remain dentally well.